I'm Kate Warren with Devex, for those of you who have just arrived, and we are continuing our NCD Pavilion today with a topic that doesn't often get the attention it deserves, and that is on oral health. Even though it affects over half the population, it is often left out of these conversations around NCDs and the links to diabetes and stroke and so many other things. It's really critical for systemic health to have oral health as part of that conversation. So we are really grateful to Haleon for partnering with us to be able to bring this to our Devex Impact House here today. First question, how many of you here actually work on oral health? Okay, well, I don't know. How many of you don't, and you're just curious about it? Okay, great. I love a little mix of both, because we want to not just preach the choir, but also get some converts in here too. Oral health has made it into the draft for this political declaration for the fourth high-level meeting on NCDs today, so we'll talk a little bit about that. It's really building momentum. It's in the 2021 WHO resolution, the 2023-2030 global strategy, and the Bangkok Declaration. So it's great to get this in these declarations on these pieces of paper, but today we're going to be talking about how we can actually turn that into action on the ground. So we're going to start out with a fireside chat and then move into a panel conversation. But with that, I would like to introduce my colleague, Devex Senior Editor, Rumbi Chakamba, to lead our first discussion. So Rumbi, I'll welcome you to the stage.
Thank you. And I will not be talking about oral health all by myself for 30 minutes, so please help me in welcoming our guest who's joining virtually, Professor Raman Bedi, who's from the World Federation of Public Health Associations. He's the Vice President as well as the President-elect. Hello, Professor Raman, how are you?
Rumbi, thank you so much. It's a really important meeting today, so I'm really pleased you invited me to attend.
So, Professor Raman, you were the Chief Dental Officer for England, and you led major reforms in commissioning the workforce, planning, and oral health integrations. What lessons did you learn from that countries could apply in this moment in time?
It's an interesting question. I think one of the things I did learn is how isolated the oral health message can become. But not only that, oral health leaders can become isolated. So we can be very influential, we can be very engaged with the global oral health community, but when it actually comes to talking to our public health colleagues or ministers or in government, we can become very isolated. And one of the key things I learned from that time is how we need to support our oral health leaders, and we need to upskill them as well. So for 15 years after I left office, I was running a senior dental leadership program for senior dentists. Basically, it's a connecting them with each other, but also upskilling them as well to be able to engage.
So you spoke about the isolation for oral health in general, as well as the isolation for oral health leaders. Why do you think that is?
We can easily become isolated. Partly it's self-inflicted, and partly it's because oral health is not always given the due attention. But we've got an excellent WHO oral health team, and we've got some great global leadership in IADR and FDI. We have all the ingredients now to actually raise the bar for the oral health agenda. And we're seeing that already in all the things that were announced just now. But one of the key things is that I don't think we are speaking to our public health community as much as we should do. And I'll give you some examples of that. I'm part of the Congress for the World Congress of Public Health in Cape Town in 2026. And at the moment now, there's no plenary discussions on oral health. There are no keynote speakers other than myself that have been on there. And we're maybe not as vigilant as we should be in getting the oral health message over. We had a great conference of the FDI in China just this month, and it was excellent that we had that. But we also in China next month have the Asia Pacific Public Health Conference, and I can say, because I'm part of the management team, oral health is not really significant in that meeting. So the message is that we need to engage more with our public health community and also be on those platforms so that we can get the oral health message engaged. Thank you.
That actually answers my other question, which is like, what practical steps can we take to ensure that oral health is embedded in national agendas? Are there any more steps that you would recommend?
Yes, I'm a great believer in connected leadership, and I think the oral health leadership needs to engage with at the national level. So give you a practical example. We are just introducing a call to action on oral health and NCDs, which is going to the World Federation of Public Health Associations Governing Council in a few weeks' time. And if passed, which I believe it will be, it will go to all 140 national public health associations. That is an incredible platform for our oral health leaders to engage with the public health and with governments at the national level. And that can be translated then to a regional, as if not to a global. So I think the key message for me is that we have to engage with our public health community. They are the power brokers in so many ways with regard to the health agenda, and we need to engage with them.
And at the start of the conversation, Kate mentioned some of the wins that the oral health community has sort of achieved, which includes the WHO resolution as well as the Bangkok Declaration. How can we turn these wins into sort of concrete policy shifts at the national level?
It's an incredible achievement. I mean, and congratulations to everyone who's been involved. We have a great platform now to build on. And that's where it needs to happen. We need to explain about the importance of oral health to our public health community. I think they know it already. It's a question of practical steps of how they engage within the NCD agenda and within government programs, health insurance, how to provide protocols and training of public health individuals so they're fully aware and literate in oral health. There are many things we need to do at the national and the regional and global level.
And speaking of agendas, there's also the UHC agenda. What role does oral health play within this?
Significant. It plays such an important role in people's lives. It's one of the largest expenditures for families of out-of-pocket expenses. We need to make sure that oral health education plus care is ingrained within government agendas. I'm particularly very passionate about low-income settings, particularly low-income countries and middle-income countries. I think the NCD agenda is very relevant there, and they will have the largest impact in those areas, but also oral health provision in some of our low-income countries is fragile, and it needs to be strengthened and supported. And I'm hoping that this agenda that we're discussing today might strengthen the resolve of many governments to put more resources into the oral health provision.
And you spoke about LMICs and oral health. So in terms of oral health, how does it mirror the inequalities that are already present in health systems?
Well, oral health has a common risk factor with many of the NCDs, and it's there that where we see the most inequality is tobacco control, poor diets, high sugar diets as well. So one of the things I often say to my public health colleagues is that when you see dental caries in a young child, you are seeing the beginnings of a roadmap to NCD development. Dental caries just mirrors the fact that there is a common risk that is developing and that we ought to be aware, and we ought to put prevention very much at the heart of what we're doing. And that will have a major impact in the development of NCDs in a population and in individuals.
We actually had an earlier conversation in the morning about prevention versus treatment. And you're saying that through oral health, you can actually tell that there might be risk factors here and something is coming down the line, and it's a chance for you to sort of kick in those prevention measures. But do you find that there's enough financing or resources going towards prevention and sort of this opportunity to identify the risk factors?
I'm a great passion about prevention, but prevention actually has to be funded and resourced, particularly for people who are financially have challenges. And we need, at a population level, to also do these endeavors. Prevention is the key. We will not be able to treat all the dental decay. We have to prevent it. And of course, I'm a great believer. The best dental material that you can have is enamel and dentine that has not decay. You know, what we're born with is the best material that we have. And we just need to make sure that our children and adults are cavity free.
And in terms of the high-level meeting, we've talked about some of the wins that the oral health community has experienced so far. In terms of the high-level meeting, what does success look like for oral health, and what should happen post the meeting and the declaration?
I think what I would like to see is certainly within every country and every Ministry of Health, is there to be a significant resource in oral health, both in personnel and also in budgets. I don't think we spend anywhere near enough on oral health at a national level. And we need to put that to the test. We need to monitor it. We need to advocate for it. And then we need to make sure that the money that is put aside for oral health is spent well in evidence-based prevention.
And how do you make that case, especially at this point in time where we're seeing budgets being slashed and countries really needing to fill any gaps that donors previously filled, and really struggling to make ends meet? How do you make the case for oral health? What would be your takeaway or call to action for leaders?
It's challenging. I mean, it's not easy. It is challenging, but we can link it with the NCD budgets and that agenda as well. This is why I'm a great believer in connected leadership. We need to train our oral health leaders, particularly at the government level, both vertically. They need to skill up and to be better equipped to be able to articulate the importance of oral health and to engage with their public health communities. But also horizontally, we need to connect them. People can connect together to support each other. I've seen that happen in countries and regions, how people are beginning to work and support each other's agendas. We need to see more of that. Connected leadership is what we need in oral health, both with the NCD colleagues, but also with other oral health colleagues from around the world.
Thank you so much, Professor Raman. I definitely look forward to seeing the work that you're doing and seeing more of this connectivity happening. Thank you so much for joining us.
Thank you so much for having me. Thank you.
So we have a really diverse group to bring some different perspectives in. Liz Arnanz, who's the Policy and Advocacy Manager for NCD Alliance. Dr. Christopher Fox, who's the Chief Executive Officer for International Association for Dental, Oral, and Craniofacial Research. Dr. Blessing Odupitan, who's the founder and executive director of Oral Health Africa Initiative, and Adam Sisson, who's the vice president and head of Oral Health R&D at Haleon. So thank you all. We also have joining with us virtually Benoit Varenne, who is leading WHO's work on global oral health agenda. So what I love about this discussion is we're bringing in perspectives from WHO, from civil society, from academia, from industry. And what we want to do is talk about how we said at the outset, oral health has made a lot of momentum, right? It's made it into a lot of these declarations. So how can we move that from paper to action when we all leave here in New York? How are you going to help countries actually put this into practice and really incorporate it into their primary care, into their prevention, into their financing? So we are blessed to be joined here with Benoit Varenne, who is joining virtually. And so I'd love to start with you, Benoit. And WHO has outlined a global strategy and action plan on oral health. And where do you see kind of the momentum happening? Where do you see things that are really working, but then also where do you worry about inaction?
Thank you, and thanks for the invitation to take part of this discussion. And sorry, of course, to not be able to join you in person. Now, it's true that since 2021, the World Health Assembly resolution, member states, countries have really shown real leadership. And it's true that it's time to celebrate, not now probably, but at least be ready to celebrate on Thursday, when it would be time of the adoption of the political declaration. Because for the first time, oral health is clearly recognized as major public health issue as part of NCD and mental health agenda. And we have a clear picture about, this epidemiological, economic, and societal burden of oral disease. So I think it's fantastic momentum, and thanks to member states and other partners, and including also, of course, the previous year work, adoption of the Bangkok Declaration. So in the meantime, given by member state with the global strategy and global action plan, academic research, and non-stake actors to work with. So we have a powerful tool, one vision, two of action, and as well as a full monitoring framework. So it's a powerful tool, and it's definitely time to deliver and to think about, global commitment into action. So a number of countries have already moved, of course. So the people leading this work within Ministry of Health, the chief dental officer, the leaders in countries, through, a number of several champion countries are making rapid progress. They are establishing, or updating a national health policy. They are training also the health workforce and putting also in a number of countries, in place a number of mechanisms and public awareness campaign, especially to focus, for example, on sugar consumption. But of course, there are also some countries who are facing challenges. And I think for many of them, it's very difficult to identify, the top 1, 2, or 3 priorities. The problems are a lot, and the temptation, is to talk everything at once. So that is where the risk lies, trying to address too many issues at the same time that can lead to inaction rather than progress. So it's a reason that it's time to work together, countries, Ministry of Health, partners, private sectors, to really support a number of countries that are have a number of challenges on the field.
Great. Well, thank you, Benoit. And I think it's an excellent point that, Liz, I'd like to bring you in on. And, we're talking a lot about, do you approach these challenges in a silo and more disease-specific way, a more integrated way? And at NCD Alliance, you've really encouraged looking at tackling NCDs from a very integrated approach. So when you think about how to prioritize oral health without the trying to do everything at once so nothing happens challenge that Benoit mentioned. Like, how do you think about centering oral health in the broader NCD conversation in a way that it's leading to action versus just one more thing that maybe gets pushed to the sidelines because we try to fit too many things in?
Sure, thanks, Karen, and good morning, everyone. Really appreciate the opportunity for the NCD Alliance to be speaking on this important topic today. So, the burden of oral diseases is staggering. Simply put, they are the most prevalent NCDs. And yet they are, as you say, sidelined in national NCD plans and also within health systems more broadly. And that's a missed opportunity because even though oral diseases might not be the leading cause of mortality, their impact is immense on quality of life, healthcare costs, as Dr. Bedi was saying, and also on comorbidities with other NCDs. And so the political declaration is not just about the recognition of poor oral health burden, but also the commitment to truly integrate oral health services in primary healthcare and also universal health coverage. But again, the question that we're all making today is, how do we go from commitment, to implementation? So, from an NCD perspective, I would like to bring 3 points. The first one is about the importance of remaining, and I say remaining because I feel like we are already very united around shared risk factors, and also against big tobacco, big alcohol, and big sugar. So we must make sure that we integrate oral health considerations in NCD prevention advocacy efforts, and by that also engaging the oral health community, as it was referred earlier, to look beyond the clinical settings issues and ask for systemic change. So it is unacceptable, for instance, that in some communities sugar drinks are cheaper than safe drinking water. And it's also sad to see that the commitment on taxes on sugar drinks in the political declaration has been removed, because we know the evidence, and that is a good practice that many member states are already implementing, and that's already a big thank you to the oral health community for that, because advocates and researchers in the oral health community have done already a lot for advancing taxes on sugar drinks. So again, remaining united in that front. Second point would be around a genuine integration of oral health services in health systems. And by that, it's not about just ensuring access at the primary healthcare level, but also establishing strong bi-directional referral pathways. And by referral, I'm not just meaning at the level of care, primary, secondary, tertiary, but also referrals within primary care. So good oral health helps to prevent other NCDs. It does improve, for instance, the prognosis of diabetes treatment. It does also enhance the quality of life of people living with undergoing cancer treatments. And also the optimal management of some NCDs improves oral health. So this means that if you are diagnosed, for instance, with diabetes, you should be referred to an oral health professional that will make sure your periodontal health doesn't worsen and doesn't impact your treatment outcomes. And if you are diagnosed with severe periodontitis, that should trigger a diabetes screening. So that's people-centered care, and that's what we need to see in practice, in addition to in policy. And third and last, I think it's also important that policymakers keep a focus on morbidity and not just on mortality, and by that also engage people living with NCDs, including oral conditions in policy. So the political declaration, for instance, fails to recognize the burden of NCD morbidity alongside mortality, and it will be crucial for policymakers to engage in meaningful discussions with people with oral diseases to understand the daily challenges that they entail, and to make sure the policies are responsive to those challenges. So, as mentioned by Benoit, we have the strategy, we have the tools. I'm pretty sure Chris will cover that we have the data. And so what we need now is political awareness and action across sectors, and the political declaration and the high-level meeting is an opportunity of that because it brings sectors together. So if oral health, if our mouth is part of our body, it should also be reflected on health systems and prevention policies.
Thank you, Liz. And Dr. Blessing, I'd like to bring you in on kind of point you had around the integrating it into primary care and how you think about it fitting into the health system. And in sub-Saharan Africa, there's a real lack of dental care. I think what is there's 3.3 dentists per every 100,000 people. So from your work in Nigeria, like what does that gap look like? What's the reality for families as they're trying to navigate oral care, given that stark reality of a lack of healthcare workers that are focused on it?
Thank you so much, Kate. Good morning, everyone. I will start with this story. In a community in northern Nigeria, 12-year-old Aisha had been missing classes. Our teachers actually thought she was just randomly skipping classes, but her mother later mentioned that Aisha had a very severe dental pain that was really hard. It was really hard for her to speak, to talk, and to concentrate. In the community where she lives, there was no dentist. The nearest dental clinic to Aisha was about 60 kilometers away, and her family could not afford the cost of transportation. Her mother had to resort to using traditional remedies and over-the-counter pain medications just to give her a temporary relief, but this did not help. At the time Aisha presented at the hospital, she had developed a severe dental abscess, and the only option left for Aisha was actually an extraction of her adult permanent molar. This is really heartbreaking, but this does not stop at that because oral health is not a luxury. Aisha's case could have been preventable, but because of the circumstances surrounding her situation, she could not get access to early care. Aisha's story is not unique, because this is the reality for millions of African children. When oral care is neglected, it does not just stay in the mouth. The effect ripples into children's education, into their nutrition, their social stigma, and also there's long-term health consequences. Recent data released by the WHO actually mentioned that 1 in 3 of the population living in rural African communities, they live with untreated dental caries. And 1 in 5 people have severe gum disease. That is to show to us that a lot of people living in rural African communities actually live with oral pain and infection as part of their daily lives. Oral care is not a luxury. It has to be treated with utmost priority. And this is why policymakers, they need to be ready to step up. Policymakers can adopt these 4 key strategies. Invest in oral care workforce. At the moment, we have just about 3.3 dentists per 100,000 population in sub-Saharan Africa, in comparison with 60 dentists in high-income countries. This is where the dilemma is. So even when people want to present to the hospital, there's no access. There's actually delayed care. Policymakers need to invest in the workforce. We need to make sure that we train more mid-level dental providers so that there's broader access to oral care. Policymakers need to focus on prevention. Prevention is key because with simple basic procedures like topical fluoridation in schools, in communities, sealant program, which has been adopted by many high-income countries. Sealant program can actually prevent cavities. Just like in the 12-year-old I mentioned earlier, I mentioned that story earlier. And also, we need to make sure that oral care is integrated into primary care, because with this, we can improve efficiency and also improve equity. And lastly, I want to mention that oral care has to come from a point of, looking at what has worked in the past, data-proven strategies to make sure that oral care gets to populations where it would have the greatest impact. Thank you so much.
Thank you, yeah. Thank you, Dr. Blessing. And I think you bring in a lot of really stark data points that help illustrate the challenges at bay. So Dr. Fox, I'd love to bring you in. about the role that research plays in obviously being able to identify where some of the challenges are, but where you see research playing a role in being able to lead to more action on the ground, being able to research that can help really change practice to see more action.
Great. Thank you, Kate, and thank you for that question. I think research has already shown the linkages between oral health and other diseases, such as cardiovascular disease, stroke, diabetes, cancers, pneumonia, among others. And these associations are strong, particularly with diabetes, that we know if a person is living with uncontrolled diabetes, that they're most likely probably also living with moderate to severe periodontitis. And we know that treating that periodontitis is going to help in the management of that diabetic patient. And we also know that treating periodontal disease is going to lower the medical costs of treating diabetes. So, research is always, of course, welcome with other sort of bidirectional associations with other diseases. I think diabetes is our strongest one. But we need further research with other diseases and the linkages between oral health and other diseases. But the evidence base is clearly already there to show that oral health is part of overall health. And as the Bangkok Declaration states so clearly, no health without oral health. Now, of course, within research, there are some missed opportunities, particularly with population-based longitudinal studies or the establishment of biobanks when oral health is not included. And such data could really go a very long way in helping to elucidate the pathways and the connections between oral health and other diseases. So that's why it's really important for academics with an oral health background to be at the table when these large studies are being designed, or at least part of the study sections when these studies are being reviewed. And if oral health is not part of it, can come up and say, hey, for pennies on the dollar, we can add an oral health component, and the payback would be enormous. The other area, I think, is on economics, and that the economic impact of dental diseases and of untreated dental disease needs to be studied. There are actually very few health economists with an oral health background. I think people on this panel in this room could probably name all of them. So we have a workforce issue also, but that's a question for a different panel. But the health economists have looked at the economic and the direct costs and the indirect costs of untreated dental disease, but we need to go further than that and look at models where we're looking at integrated models of oral health care with overall health and the economic return on that versus treating oral health in some sort of silo. And we need to be able to show the ROI on that kind of model, and it needs to be part of our NCD frameworks. Finally, I would just add that the fact that oral diseases are so robustly featured in at least the final draft that we've seen of the political declaration is very, very strong. We started this process in 2011, and some in this room and on this panel perhaps were here in 2011 when the first high-level meeting on NCDs merely recognized that oral diseases played a burden for countries. But then there was no action paragraph after that. Just recognized it. Well, what are you going to do about it? We're at a very different point now, clearly with the WHO oral health resolution in 2021, the subsequent global oral health strategy and action, the Bangkok meeting ending with the Bangkok Declaration. And so this latest draft of the political declaration clearly not only recognizes oral diseases in almost the same language from 2011, but then also notes the 3.7 billion people with untreated dental disease, which is so important. And then in a section called Strengthening Primary Health Care, calls on countries to, quote, scale up services to address the excessively high rate of oral health conditions through health promotion, prevention, early detection, and treatment, and apply multi-sectoral strategies and integrate oral health services into primary health care and universal health coverage. This is very, very powerful. That advocates, including key stakeholders, including those living with oral diseases, professionals, researchers need to leverage to make sure that oral health is included from this point forward whenever we're talking about NCDs and universal health coverage. Thank you for the question.
Yeah, thank you. So Adam, I'd like to bring you in, and we need all stakeholders at the table, right? And I think there's been particularly a lot of discussion as some traditional funding sources of global health work have gone away or gone down. What's the role of private sector? So I'd love to hear, how you think about this at Haleon and what work you're doing on private sector partnerships, and specifically in really integrating oral health into overall the NCD agenda.
Yeah, thanks, Kate. So first of all, let's remind ourselves of the burden. So 3.7 billion people have some form of oral health disease. And I firmly believe that if we're going to make a realistic impact on that over the next 10 years and beyond, we need to continue to think of the partnership model. And I think Professor Raman said, how do we have collective leadership in this as industry, for-profit and non-profit organisations working hand in hand to make a difference with regards to all these people that have oral health diseases. So let's think about close to what we do in Haleon and some examples of how we can bring that to life. So one, here in the US, we've already heard that access to dentistry is really hard. That's the same case even here in the US. We have a wonderful program between Haleon, Walmart and Remote Access Medical, which enables us to give free dentistry access to underserved populations. And through doing that, we've been able to give a huge amount of dentures and partial dentures to people who, without that partnership, would never have access to dentistry. So that's one really great example, access. The second one is around health literacy. So we know, we've already heard again, the issues with regards to dental caries in children. There's a real opportunity working hand in hand, industry and non-industry, around how we educate parents and children with regards to the benefits of topically applied fluoride toothpaste to make sure that they're protecting themselves against dental caries, and we reduce the burden that we're seeing. A wonderful, heartwarming story from yourselves in your country. Very difficult, and we're seeing that burden increase, actually, with regards to children. So collective effort there, health literacy in children. And then lastly, Dr. Fox has said that I think we all recognise the impact on people, because there is no health without oral health, but we also have a need to be able to quantify the economic burden of oral health diseases. And again, that's where industry and non-industry partners can come together. We've done some fabulous work sponsored by Haleon with Economist and Economist Impact, and we've been able to qualify the cost of some of these interventions and really support the need to change from repair dentistry into preventative care. So 3 examples: how do we get access to dentistry, how do we help health literacy, and how do we support the understanding of the burden of disease? So that's where we can help.
And I would like to actually bring you back in, Dr. Blessing, and where would you see private sector being useful? How would you like to see them engage in the work that you're doing in Nigeria?
Okay, thank you so much for that question. I would say for the private sectors, there's a need for cohesive partnership with the public sector, just because the public sectors cannot work just on their own. They need the support of the private sectors. And one other thing we need to know is with the initiative I work with Oral Health Africa Initiative. We've been going out for the past 7 years to the community, trying to teach them, just like Adam mentioned, lots of literacy, lots of taking them, bringing mobile dental clinic to them, just so that they can have access to dentistry, basically. So I think the private sector, they need to work hand in hand with the public sector, like the NGOs, civic societies, so that we can all cohesively achieve one vision of bringing oral health to really to communities that are kind of underserved. Thank you.
Thank you. And Benoit, I know we haven't forgotten about you there online. I'd love to hear from your perspective where you see the role of large institutions, multilaterals, like WHO bridging the gap, and then where you see the role for private sector or civil society to fit in, and how you envision that all working together.
Yes, thank you. So I think WHO is not good on all the element, but we are quite good, in bringing people together, and so bridging, gap, for example, between researcher, academic, and people on the field or policymakers. So our main, I think, agenda is really to, to develop some evidence-based policy, cost-effective intervention based on the best evidence coming from the research side, and translate this into a kind of operational policy option for adaptation and things like this. So I think we can definitely continue, and accelerate this this dynamic, and bring together, partners, including a large scope, and including, of course, private sectors, to ensure that with a focus on low-income settings, with a focus on intervention that have an impact, at population level. So I think all this work we can help, to again bring together, to create some platform. And what we have decided together, during the Bangkok meeting, is to establish a global coalition on oral health. And this global coalition on oral health that will be launched hopefully by the end of this year will bring together, a number of partners from different sectors, and work together on a number of concrete products that could support WHO effort, but also contribute directly, to support countries and national leaders to implement a number of activities. So this is our plan, and I know that partners are ready to join this coalition.
Thank you, Benoit. And Dr. Fox, I have another question around, how you can translate research into action, and like that translation gap of how to take the research that you and your colleagues are doing and really have that move into scalable models and into guidelines and training, and what other partners do you think you need to bring to the table to see that?
Thank you for that question. That is really the key challenge. You often hear oral diseases are preventable. We know how to prevent oral diseases. Really? With 3.7 billion people with untreated disease, we know how to prevent disease. We may know how to treat disease on an individual level or in small-scale randomized clinical trials. We certainly don't know how to prevent oral diseases on a population level, and that's where implementation research comes in. And Dr. Varenne just mentioned the Global Oral Health Coalition, and IADR with some colleagues at the University of Heidelberg and University of Sydney will be leading a section on implementation research. So we need to design implementation research approaches on how interventions can work in real-world settings with all the limitations and barriers and enablers within real-world settings. We need to involve key stakeholders, including, importantly, the communities that we're attempting to help, ministries of health, researchers, economists, and healthcare providers. And then the research questions within that implementation research needs to align with the goals of integrating oral health care within primary health care and universal health coverage as outlined in the WHO Global Oral Health Action Plan. And so you can envision various implementation research pilot studies that integrate oral health care into diabetes management, maternal and child health care, cardiovascular care for high-risk patients, and to build in economic modeling in these studies to demonstrate the ROI, and if successful, then to be able to implement them, change policy, and implement them on a population level. And then importantly, as was mentioned in the last panel also, and also by Liz, is that the broader NCD interventions of sugar reduction and tobacco control, harmful use of alcohol need to build in oral health metrics, because often it's the oral health care benefit that is going to be first to show in these interventions. You may say, for instance, with taxation on sugar-sweetened beverages, you'll first show a reduction in consumption, but in terms of a health benefit, you're going to see the reduction in dental caries before you see the reduction in obesity and diabetes. So thank you for that question.
Thank you. And I know we're getting close to the end of our time here, but I would like to hear from each of you, what are the other stakeholders that you would want to be bringing to the table this week and beyond to be able to really translate this to action? Or what other kind of policy would you like to see come out of particularly this high-level meeting on NCDs this week? And Liz, I'll start with you.
Sure, thanks. I think Benoit made a very good point at the beginning about the fact that we need to help governments to prioritize a certain number of interventions so that they have a starting point with this commitment in the political declaration. And there are many tools that we need to raise awareness about, not just with ministers of health, but other sectors that have a role. And there are, for instance, best buys on oral health that many policymakers are not aware of, and they have strong cost-effectiveness analysis that can help those governments to know how to prioritize. And also, for instance, there's a number of dental preparations that are part of the WHO model list of essential medicine list since a few years ago, and we need to see that translate into national lists. So basically, going beyond just the usual suspect that we speak to in government, given that they are now here in New York this week, would be very crucial.
Thank you. Well, I'll just go down rapid fire. So, Dr. Fox, you next.
Yeah, I think this political declaration is a real milestone for oral health care. And it's not the end, it's the beginning. It's a real advocacy document that we need to be taking to governments, to private sector, to other stakeholders, and really leverage that document and to move forward that oral health is truly integrated into NCDs, primary health care, and universal health coverage.
Right. Dr. Blessing?
Basically, the main action for policymakers is to embed oral health into universal health coverage and also the primary health care system. And I would say to improve outcomes, policymakers need to focus on these three key areas: prevention, early intervention, and ensuring that care gets to underserved communities. This would actually help to improve health, the health outcome, and also it can also, reduce inequality while we all work together to achieve equity. I would want to say that policymakers need to know that there is no health without oral health. Thank you.
Thank you. Adam?
Yeah, very quick one. A huge milestone this week, and I think it is the start of the marathon. It's going to be a big journey to impact these 3.7 billion people. And I'll say very similar to what I said earlier, which is that needs to be done collectively. So collective leadership across industry and not-for-profit organisations collectively, recognising that it's our collective power that will make the difference.
Right. And I will say we are going to open up, have a little bit of time for our audience Q&A, but before we get to that, Benoit, I'll let you have the final word.
Thanks. No, I'm just thinking about, of course, the change that will come for sure from the field. Integration is also a reality in a number of health facilities, and unfortunately not regarding NCDs at large. So I think if there is a priority really for policymakers and other actors, to push some aspect, is really to make available a kind of NCD platform for prevention and management of NCD at PHC level. It's the only way that we'll achieve UHC, having this package of essential intervention across the different NCDs with basic care and prevention, and this based, of course, on the workforce available in PHE. We are not waiting to have a dentist in every primary healthcare facility. And there is a lot of strong evidence on the effectiveness of this. This will help a lot, for sure. Thanks again.
Thank you. And so we will open up for some audience Q&A. We have a little bit of time here, but we have someone in particular that we would love to hear from. We have Kiran Nagdeo, who's the Vice Chair for the Oral Health Work Group for the World Federation of Public Health Associations. So Kiran, we'd love to hear from you first.
Thank you so much. Thank you. I think this was a very rich conversation. Thank you to all our panelists, and thank you for inviting me here. This was wonderful. We heard from Dr. Bedi talking about how we are completely isolated. And this is a conversation we've been hearing for years, that we're very siloed. Everyone's talking about breaking the silos, but also how do we do that? Then there were all these conversations, the wonderful story of Aisha. I'm sorry that is happening still, even in 2025. It's the whole idea of how we can translate research into actual implementation. So the idea of implementation research, 3 points you said about how Haleon's been working about it, access to dental care, health literacy, and one other point. So it's been really instrumental to have these voices heard together. We've seen a lot of momentum along with the celebrations that we've had with the resolution and the Bangkok Declaration. We have these powerful tools, like Dr. Varenne said, with the Global Oral Health Action Plan and the strategy. But you see that this year particularly, we have a lot of momentum with oral health. We have civil societies coming together. We have this event. We have tomorrow with the Malaysia government and the political declaration draft actually at the high-level meeting that has inclusion for oral health. But one thing that we see, and while we have created this platform for advocacy through the Bangkok Declaration, the challenge is quite clear, is how do we embrace the public health community? And I wonder how the panel would like to suggest we do that.
Thank you. And I'm actually we can take a couple more questions and then we can address them as a group. So if you would like to ask a question, please raise your hand and we will get a mic to you.
Thank you. Thank you for giving me the floor. Thank you to the panelists. I'm happy to be here and to listen what you're saying. You're absolutely right. We have the theory. After 25th, we will have all the documents we need to work in the field. But we forgot something. We need partners concerning systemic health. Who are they? Medical doctors, medical sisters, midwives. Nobody mentioned about them. Mm-hmm. We will be absolutely lonely in the field if we do not have them as partners. Thank God that our governments are here, and on 25th they will hear a lot of the ministers of health to mention in their speeches oral health, and this will help. But work in the ground, work in the field is the most important and challenging, because 80% of the population has no access to adequate oral health, not dental health. Oral health, please, let us correct our terminology. And my question is how to engage our medical doctors as partners, the medical societies at national and international level. Thank you very much.
Great, thank you.
Oh, I forgot to present myself.
Great, yeah.
Am I?
Yes,
you
please
didn't
do.
ask me. If you ask me, I said, oh, well, what a nice question.
We would love to have you introduce yourself.
So, my name is Dr. Nikolai Sharkov. I'm the president of the World Dental Federation, FDI. Thank you very much.
Thank you so much. Great. We will do one more, and then we'll have to quickly try to address these as a group. There's someone in front here. I will say we also are going to have a whole networking lunch after, so I really hope everyone stays and we can continue the conversations that we can't have on stage. Yes,
my name is Christian. I am I'm a data strategist in the private sector, but I'm also a public health educated. I'm an MPH from Michigan. My question is, we haven't talked about it, and I feel like we're eluding it, the attack on science. Because all of you are experts in your field, have worked very long years within the public health domain or the health domain in general. And oral health is, if we talk about the impact of attack of science, oral health is very overlooked, extremely overlooked, even in the United States, as you have pointed out. What is your take on how we should be approaching our government's approach to health? Especially here, I live in the US, so I don't think I need to tell anyone where our healthcare is really headed. But I would love to get your feedback on, what should we be saying, what should we be doing, and how should we be advocating for our communities that do need access because we've been using that very broadly. Yeah, thank you.
Great, thank you. So, I mean, a couple questions that touched on just how we actually integrate oral health within our primary healthcare system, recognizing that many of the frontline healthcare workers are not necessarily trained, particularly in dental or oral health, and so, like, how do we do that? And then, I don't know, maybe Dr. Fox will have you tackle the research question. We both live in DC, so we're really in the heart of a lot of those conversations. But let's see. Well, I would love to start with you, Dr. Blessing.
Thank you so much for that beautiful question. I would say that for the, public health officials, we all need to be accountable. I work in a public health setting, and the organization where I work, we actually have a dual approach to community outreaches. We make sure that we provide care while also gathering evidence, so that when private partners want to collaborate with us, we have data available for them so they can see what the problem actually is on the field. And once they see the problems, we also try to present the solutions, cost-effective solutions that we see on the field. So it's not just the random fillings at the dental clinic. Sometimes just topical fluoridation for primary school students, secondary school, it goes a long way to actually prevent cavities. So we try to present all of this. When the government see that, when public and private partners see that, they can relate, because it's more like bringing real-time data, connecting that to real people. So with that, we can address the issue of the government getting involved or private partners getting involved in oral health issues. And I think with that, we can all work together to make sure that we are all accountable, whether as public, policymakers, private partners, researchers. Let us be accountable, present real-life data so that everyone can see and then they can work with that. Thank you.
Thank you. Liz, I'd love your perspective on that.
Sure, thanks. I think on your point as well on embracing the oral health community, I think we need to stop differentiating the oral health community versus the health community, correct? So I think it's also about us as a broader NCD movement to bring oral health advocates, researchers in a more consistent and regular way, and vice versa as well. When oral health community convenes, that they bring in different medical professionals. So I think it's a two-way effort that needs to just become natural. And then I would like maybe to sort of answer to the question of that. I mean, obviously, I'm not an academic, and I cannot completely say it, a complete answer to your point, but I can say that as a civil society organization that we focus on advocacy because we aim to promote the public good. I mean, we base all our advocacy on evidence, and without evidence, we just cannot really go to governments and say, we're right, because at least on the prevention work, we are facing the challenges of facing health-harming industries that have so much more resources than we do, but we have the right arguments because we can base ourselves on evidence. So I think a key ask is for us to keep making sure that as part of our advocacy, we're asking for resources on research, and that oral health obviously is not neglected in those efforts.
Great. Dr. Fox, I know I put you on the hot seat for the research question.
The research question, yeah. I don't want to get too much into U.S. politics in a global forum, but Christian, thank you for raising the question, but how can you avoid it when the U.S. has pulled out of the WHO and has pulled back and basically shut down USAID, et cetera, et cetera? It's a huge global impact. So your question specifically was, how do we address governments? It's with advocacy. And I hope you know personally your Michigan senators and House representative, if not their staff. We need to be going to these offices and talking about the importance of health. And even though the president's budget called for a 40% cut of the NIH budget, both the House and the Senate in their appropriations committees did not go along with that. They're going more for flat funding, which is not ideal either, but it's a heck of a lot better than a 40% cut. So, governments need to respond to the people, at least in democracies, and we need to make sure that they hear our voices loud and clear in forums like this and in one-on-one conversations with your elected representatives. And if you come to DC, I'll make sure you get an appointment with your Michigan senators and House of Representatives. Thank you.
Great. Adam?
Yeah, I'm going to try and tackle that maybe from a slightly different angle. So I think that evidence-based solutions are really important, and we need to think about trusted science within that. I think your question was around misinformation. There's a lot of misinformation out there, whether that's from social media, unfortunately from actually policymakers at times. It is a privilege of our oral health community to say we need to have evidence-based solutions that are peer-reviewed, that are essentially agreed and challenged by world-leading experts. So it's really important that we continue to foster fantastic groups like IADR, FDI, and that we are able to make sure that when we put forward science-based solutions, whether that's self-care interventions like toothpaste or mouthwashes or more broader repair type interventions, that they are agreed on by a broad community, and then we can set those guidelines. So really think about, science should be effectively challenged, because otherwise, we wouldn't have moved on from 200 years ago, and we'd still think the world was flat. So we should effectively challenge the science using the latest data, but we need to do so with a way that collectively involves all of the opinions. And if we're missing some data, we need to find a way to fund that across the sector to make sure we've got the evidence.
Thank you. Benoit, did you have any final thoughts on either of those questions?
Yes, thanks. Now, maybe a note on from the question from the FDI president. It's true that it's definitely crucial, to be able to be engaged and to work closely with medical doctor, midwife, nurses, health community workers, because they are, in the field at this PhD level, and we know that they can be also providers of a number of essential oral health care. Again, as part of this NCD platform that we have to think about. And after that, of course, the community engagement, I think it's key, and community could help, so again, to bridge, all these healthcare workers together and make clear that they want a more holistic, approach of health and healthcare. So we can definitely progress on this front as well, working better with people, with lived experience, and community engagement at broad. It's definitely crucial for the work ahead. Thanks again.
Right. Well, thank you, and thank you all so much. And I think you really laid out a lot of the opportunities that are ahead, and I know there's a lot of excitement around the meetings later this week, and hopefully you got some ideas of what we can do after next week when people go back to their countries and want to really put this into action. So thank you to Haleon for partnering with us on this session. We also invite you to stay for a lunch that we'll be having here, continue the conversation. Also, thank you to Haleon for feeding us after this conversation. So please join us for that. And we'll be resuming back here on this stage at 12:30 to continue our programming for the NCD Pavilion. We'll have a conversation with Vanessa Carey and looking at the climate health nexus as it relates to NCDs. We also will have a live taping of our This Week in Global Development podcast at 12 downstairs on the second floor on our Innovation Terrace. So if you are a listener to the podcast and want to see it live in action, we invite you to go listen in. But otherwise, please stay and enjoy. And join me in thanking our panelists.